and we're going to go ahead and start with our Vatech Ez3D-i software. So here's our Vatech Ez3D-i software. What we're going to be doing is we're going to navigate from here over to our Ez3D-i software, but first we need to figure out how to get there. So what I've done is I've opened up my Ez3D-i software. In the search bar, I can search for my patient. So I went ahead and typed in my 17 by 15. It gives me a list of patients' names. And I've got two separate 17 by 15 scans here. What I'm going to focus on is my top one, the 17 by 15 green here. If you can see over to the, when you see over to the right here, I've got my CT. So I'm going to hover over this. This is going to tell me the field of view that we captured. So this is one of our larger fields of view. And above that, I have a few screenshots that we've taken from the image. So what I'm going to go ahead and do is go ahead and double click here. And once I double click, what that's going to do is it's going to pop open my Ez3D-i software. So we can see my 3D software is popped open or opened up on my screen. So you can see down here at my toolbar, I still have my Ez3D-i software, and then following, I also have my Ez3D-i software. So a little bit about your Ez3D-i software. Let's just do an overview of what we're seeing here. Ez3D-i, top toolbar, you have your NPR screen or NPR window. This is what you're going to see once you open the scan. You have your four boxes here, your coronal, your sagittal, your axial, and followed by your 3D window. Overall view of what we're going to cover today, we're going to make our way through these different tabs, sectional, 3D pan, TMJ, all the way through our tabs. Underneath that, we're going to identify all of our icons, individual icons here. You'll notice next to my reset button, I've got a measurement, and this tab shows us our submenus. So if I click on capture, I've got some other tools over here. As we progress through the demo today, we're also going to look at our left toolbar. So here's our simulation. You can see we have draw curve, insert implant. We're going to talk on some airway measurement tools today, look at our oblique tool, go down through our VR coloring, all the way down through change layout and through the software. So that's going to kind of be the format. What I would really like us to focus on today is we're all at some variation of the software knowledge base. What we're trying to bring to you today is a working flow of the software, so you can sit down and navigate 5 minutes to go through a scan, do your clinical planning, be it implants, endo, extractions, ortho, or airway, TMJ. We want to be able to go through this so it's not a burden, so we can just methodically go through the software there. So let's start and look at our NPR screen here. You'll notice I do have my 4 windows here, and that's what the software defaults when it's first installed. I'd like to go over here to my change layout. So I'm going to click on change layout, and you'd notice you have different ways you can customize the view. I tend to customize my view up here for one of the top 3 boxes. So what I'm going to do is I'm going to right click here, set as default, and now we are on our default window here. So you'll notice now I have my virtual rendering enlarged on the left-hand side here. Why I like this screen is because I can come over to my axial window and right click and switch this to the main view. So now I still have access to all of my other windows off to the right-hand side. Let's go ahead and start talking about our axial window here. So our axial window, see it's highlighted in blue. Something to note, if you look off to the right in our other windows, I have my blue slice here. So as I use the wheel on my mouse and scroll, you can see I'm scrolling down inferior, and at the same time, my blue slices are moving across. If I come here and I scroll with my wheel, we're scrolling further superior, navigating through that image. So everything's going to be color coded. Axial is in blue. Other things to note, we have our right side here and we have our left side. So with our axial slice, we're actually looking from the foot looking up. Let's go over here, and I'm going to go ahead and enlarge my coronal window by right clicking and switching to the main view. So you can see my coronal view here. It's our AP view, our anterior, posterior. You can see here we have our right side and our left side. This is highlighted in gold or in yellow, and you can see my gold or yellow slice here, And off to the bottom, my 3D view here, I can scroll, and as I scroll going further anterior, scrolling through the image, and going back posterior through the image there. All my lines move, my coronal line is moving as I'm navigating this window. Lastly, we're going to look at our sectional window here. So switch over to main view. And now I can scroll lateral or medial here and lateral across the image. We have our anterior and our posterior being noted here as I scroll through there. So I'm going to come back over here and right click, and I'm going to go to switch to main view to enlarge our axial slice. And let's look at some other ways I can move or navigate through my axial window. So I might come over here to grab my axial line here and drag this to the superior border of the scan. What this allows me to do is get to the top of the scan. Now I can just use the wheel on my mouse and I can scroll down through my scan, identifying all of my anatomy through here. So we have our superior sinus through here. We're going in down into our condyles, nasal concha through here. As we keep scrolling down, if you notice over here in our 3D rendering, I'm scrolling through that and kind of gives me identifying what I'm seeing. I can see all of my root tips here, going through maybe identifying fourth canals on molars, our airway, our spine, and let's keep scrolling down here into the mandible. As I scroll down further, I can see our mental foramen and down to the bottom. So if you are looking for tips and tricks and topics of workflow, this is the first thing that my doctors and radiologists are doing, is we're taking that axial slice, moving it to the superior border, and now we're going to go ahead and scroll down inferior through that scan. One thing to note here, I use a lot, let's look at our first tool here, is going to be our reset view. What we can also do with these lines is I can grab the center if we want to target a certain area. So here we're going to scroll down. We're going to go ahead and look over here at our condyle. And you can see I'm moving my sagittal and my coronal view. And in that sagittal window, we can see my condyle there. I can also rotate my lines through here if I want to rotate along these axis lines. I use my reset view to get back to the beginning of the scan, or the default how I open my scan there on that. Let's right click here and switch our main view here. And our 3D window here, our virtual rendering, we can left click and we can go ahead and rotate this around. I have my quick buttons down here to kind of navigate through my image itself. Paul, do you want to talk about any other tips and tricks within this, MPR window that you use out in the field?
Sure, Jim. A couple quick buttons, I would say. So you have your space bar, which will take your plane lines toggle on and off for you. So if you hit the space bar on, space bar off, space bar back on. Another good tip for navigation, jumping from window to window, is to place your cursor over the window that you want to enlarge. So if I want, that sagittal window enlarged, just hover your mouse over it and hit the enter key. And that'll zoom in. You can also double click on the word sagittal too to expand or collapse that window. So that's another one. Another one I like to use is if you want to zoom in. So for instance, we're on the axial view right now. So if you want to zoom in, you could use that magnifying glass on the toolbar up there. That'll zoom in and out. And then you can use the hand next to it to move it around when it's zoomed in. But I like to use the keyboard shortcut, which is going to be the control key, and then using the scroll wheel on your mouse. So if you hit the control key and scroll, it's a nice way, because your hands are both on the computer and the mouse, to zoom in and out that way. And then another kind of a quick tip, I guess, it would be to click on the 3Ds. Like, so for instance, if we want to click on a certain tooth or a certain area, we can just double click on, let's say, tooth number 9, for example. If I want to kind of focus in from there, I can double click on the tooth itself. It then aligns the planes in the right direction there, and we can kind of fine tune from there. But that's a quick way to kind of focus in on a certain area on the scan.
That's a great tip, Paul. So yeah, so if I want to go over here, I can, let's say, double click back here on my third molar, what that's going to do is jump all of my slices right to that area to navigate through. So now I'm going to go ahead and right click and enlarge my axial slice, and we can see we're focused right there on that third molar. What I might do here is kind of rotate my lines to go through the long axis of my image there. And now you can see as I scroll superior and down inferior, we can look through that tooth there. We're gonna go ahead and do my reset here, and we're gonna reset our MPR. And now we're really back to where we started for our plane of view right there. Paul, I think right now it might be a good time to jump over to our 3D pan view on there.
Yeah, that's.
You know, for workflow, what we did in the beginning, I enlarged my axial slice. I'm going to go ahead and drag my axial slice to the superior border of the scan. I'm going to come here. Paul talked about hitting the space bar, and now we're going to scroll down, identifying our anatomy, our orbits, going through our sinuses, our condyles over here, external auditory medius, nasal concha, hard palate, and really just kind of scrolling through that to give us an overall view, kind of a starting point. Then I'm gonna hit my space bar here. So let's navigate over to our 3D pan view. So what the 3D pan does is it takes our 3D rendering, and what it's gonna do is it's gonna flatten it out. So you can see here, I've got my 3D pan kind of flat into a flat surface. What this does, it allows us to easily navigate through our image itself. Let's look at the 3D pan window overall. First, I would still start over here to the lower right. We have our change layout window. It's going to be defaulted to our 3D pan at the top, our scout image over here, and 3 sectional slices. You have an array of different images that you can change if you would like. So I'm going to leave it on our 3D window here. Some quick navigation through this. I can grab here in the center of my navigational box, and let's talk about this. So we have our axial slice over here. We still have our right side and our left side, so the orientation we're used to seeing on our other windows. Within my navigational tool here, let's look at my center red slice. You can see here slice number 35, and I'm going to go ahead and double click here because I just want to see one window. So right here we have our buccal and our lingual. As I scroll through that, you see I'm going more mesial, and now let's go distal through that image. What I like about this window is I can grab here and I can physically move my whole box, the green box here, and I can rotate my red lines here. All right. As I scroll through here, we can go through our image and we can look at different anatomy. So you can see my nerve down here, the width of my ridge and the height of my ridge. We can kind of navigate through this here. Other things we can do with this window here is we can grab, I can rotate this, and now I'm looking at more of an axial slice here. So you can see my horizontal axial slice. I'm going to go ahead and scroll down through that image, identifying and looking at my individual canals. So any endodontists out there, let's bring this up to a first molar. Scroll here. See, I'm just about in the furcation here. I'm going to go ahead and scroll down to my occlusal surface, and let's go ahead and scroll back up. We can identify our individual canals through here. So all the way through there. And I'm going to do a reset here and come over, reset over here. Other things in this 3D window I like to do is I like to turn this to my MIP, and we're going to talk about those VR coloring options here in a second through there. Paul, did we have any questions coming in?
Yeah, we had a couple. One, we have a question that's saying, how did we get to the workflow page that you had on the earlier MPR view? I think that's referring to changing the layouts. Maybe you could just review that.
Sure, yeah, let's go down to our layout over here. And then this is where we can navigate to different views. So if I want to look at my 4 windows, I can click here. It takes us back to our 4 windows. If I go over here to change layout, I can come over here click on this. See the gold band here? If I right click and hit set as default, it's going to enlarge that window over there. So that's one of them. Paul, I just got a question here, and it says, what does MPR stand for? And that's going to be multiplanar reconstruction. So that's a question I kind of get a lot. So we have our 3D rendering here. We have our different planes of view. So that's going to be our multiplanar reconstruction window through there. All right.
I got another one, Jim.
Sure. What do you have there, Paul?
I just think it applies. It says my 3D pan doesn't look like that. It looks a little distorted. How do we fix that?
Good question. So what we're referring to is our 3D pan window. This gives us a nice rendered pan through here. Sometimes we may want to recreate a reconstructed 3D pan here. So what I'm going to do is I'm going to come down here to the lower left. I'm going to go to create pano. So we have our pop-up window here. What the software does is it automatically draws a curve across here. So you can see I can grab these yellow lines to manipulate my height of my image. I can also move my lines around here. So if I wanted to come in, I could reset that and redraw my lines here. So depending on where I draw my curve, this also has to do with patient positioning. If the patient is malpositioned, we may not get a nice rendering. But let's double click here and we can see it's going to regenerate my curve here. So that will regenerate our curve in this window. So let's give that a second to regenerate. Well, this might be a good time to talk about, some of our clipping or our camera tools and options to do our camera. So see how my screen kind of regenerated there? I'm going to go ahead and scroll the wheel on the mouse, and you had talked about hitting the space bar. Let's go ahead and hit our space bar here. Toggles that off, toggles that on. Paul, do you want to kind of talk about some of our capture and our capture tools within the software? Sure.
So the capture tools is referring to basically taking screenshots of anything in the software. So you're going to bring up what you want. So as an example, if you want to take a screenshot of everything on the screen right now and save it as a separate JPEG file, the camera icon up there, which is on your green toolbar, all those tools to the left of the word measurement there are the most commonly used tools. And then there's additional tools to the right. But the camera that's there all the time by default, you just basically click on it, and it's going to capture a screenshot of the whole screen. You can see it says saving to server. It's going to save a copy for you in Ez3D-i as a separate JPEG, which you could then export or pull on a report, and also in the console tab, which Jim will get to. But if you just want to take a screenshot of just one panel, maybe you just want that 3D pan or something along those lines, you're going to click the drop down where it says measurement by default, and you're going to switch it to capture. And there's going to be some additional cameras you'll notice there to the right of it. So the first one is a snag it or a clip it tool. It's called capture region. So if you're familiar with the clip it tool in Microsoft, works the same way. You're going to click in the upper left hand corner and drag and then let go, and it's going to capture just that window as you see there. So it captured that little section. And then if you want to capture a window, the easiest way to do it is just to click capture window, which is the next option. So we click on that. You hover over the window that you want, and you'll notice that right there it says with or without overlay. Overlay is going to be any of the drawings, virtual nerve that you type on there. So we can just do with overlay, and it saves that to the server there. So it's now saved those 3 screenshots that we just did.
Thanks, Paul. Yeah, let's look at where those are saved at. And you can see up here, we have our different images that we captured. So here's one screenshot here. There's our full 3D pan, and here's some other screenshots that we've captured on there.
Yeah. And
so I'm gonna go ahead and hit my space bar here.
Yeah.
And we're gonna go ahead and go down to our lower left over here. We're going to rotate our line here. And I'm gonna drag this right to my intersection here. Let's talk about workflow of looking to trace the nerve. You come down here, we can see my inferior alveolar nerve right here. So as I scroll through, I'm going further posterior. I can see the nerve bundle. And I'm scrolling back to my third molar here, seeing that outline. going further posterior and then back. Let's say I want to enlarge this window. I might double click on my sectional, and now we have one nice large screen to go through. So I'm scrolling back posterior. I'm going to come up here to my nerve trace, and I can draw my canal on there. But I think before we talk about that, one question we get a lot is, what are my intervals between each time I scroll? If I right click here, I can go down to my intervals, and right now I'm at 1 millimeter. So every time I use the wheel on my mouse and I move between slice 64 and 63 or 64 and 65, we're scrolling at 1 millimeter increment. So I'm going to go ahead and double click to enlarge my sections. I'm going to scroll back posterior up into the ramus. I'm going to go over here to my nerve, and I'm going to go ahead and click right the center. It places a point. We're going to go ahead and scroll forward. I usually click about 3 or 4 millimeters or 3 or 4 clicks of the mouse. Click again. Let's go ahead and click here. And I'm just following that through. And let's move forward. And we can go ahead and click again. And I saw my mental framing go by. We're going to double click here, and it's going to finish our tracing. So let's go back up to our section and let's kind of see what we have here. So you can see that I've traced my nerve on line across my mandible there. From here, let's look at some of our measurement tools, kind of leading into maybe some implant planning. We do have our implant planning tab here. So let's come up to our length tool. I can click on my length. I can left click here and left click here. It puts my measurement on there. I'm going to start from the crest of the ridge and drag down all the way to my nerve, and we can go ahead and back that off a little bit and left click. We can left click to drag these out of the way. And now we can look at our implant planning. Let's right click here to delete, and I'm going to go ahead and right click here. I'm also going to look at some of these properties here. Let's go ahead and hide this on there. So let's say I want to do my implant planning through here. I'm going to go ahead and come to Insert Implant, our pop-up window here. And we have our tooth list. We can place a single implant or multiple. And within the coming weeks, especially next week, we're going to delve more into this implant planning window. And then the following week, look at a lot more features of specifically of the implant planning, adding crowns, guide and path, etc. So implant planning, we're going to say we're on tooth number 19. I'm going to choose my lineup, and I already have mine preset for Straumann here. We can choose our implant. And what I've done is I've come over here and I've set this to default. So the next time I come into tooth number 19, it's already going to be set for that default. Down here, access and click point, I'm going to have this set for access. And what that is going to do is going to have my platform of my implant to be at the blue line here and the angle of my implant at my red line. So let's go ahead and click on insert. And you can see the insert follows that path right there. If I click on my implant here, I get the X around there, and I can move this bodily around. Other things we can do, we can rotate our implant here. I can come up here to also rotate my implant here. If I need to edit this implant, I can go ahead and right click, come down to edit, and we can see that we're still within our Straumann, our bone level, our rock solid implant. We can come down and let's say we can look through here and we can go smaller within that Straumann implant line, or we can take that larger. You can also change your diameter here. And I'm going to click on OK. If we place this too close to our nerve, we do get an activation that says collision warning. So what this is going to do, it's going to tell us our predetermined border that we're too close to that nerve or to an adjacent implant, and I would go ahead and back that off or move that around or maybe change my implant size on there. All right, I think now would be a good time to come over here to look at changing our layout. And let's go into our change layout. I'm gonna go over here to this third layout box, right click and set that as our default. And what I have here is my bone density window. So we've placed our implant here. And if I come in here and I'm going to go ahead and left click around and drag, and you can see our green peg, which correlates to our scout image. So we're looking buccal in lingual. And as I rotate that around, we have a density range off to the side. So it's color coded. So if we look here, we have 0 being distilled water, the reference for Hounsfield unit range. Negative 1,000 is going to measure for air. And then D1 bone is going to be in the yellow to green area here. So as I rotate this around, we can see we are in a little darker area here, and that's probably going to be a marrow space. So if I grab this and I move this out of the image here, we can see that we are perforating, and it does indicate that red range or that lower density range through there. Let's move that back into my implant site and move that up, and we can see our implant placed on there. All right. We had talked a little bit about navigating this for endo. So how would I use this for endo? I'm going to come up here to my first molar here, and I'm going to rotate this so our slice is going to be horizontal. And I'm going to double click just to look at one window here. So as I scroll through here, we can kind of look at our individual slices here. Paul, what do you think now would be a good time to talk about some of our windowing and leveling or brightness and contrast tools?
Yeah, absolutely. And that's really important, I think, because, you know, every view is kind of a personal preference, but these are some nice options over here. So on the left side of the screen, it says windowing. That's our brightness and contrast. So width and level basically is brightness and contrast. So moving your sliders up and down. Level for contrast, back and forth. But when I first open a scan, usually I'll use this section and I'll first click max sharpening. So you can see there's sharpen and max sharpening, and that really makes your image really crisp. Use the sharpening. So there's sharpen, and then if you want it a little bit more, you can try max sharpen, so you can kind of toggle between. If there's scatter in your scan, sometimes the max sharpening is a little too grainy, so that's why the sharpen is a little bit less, so you can kind of toggle between those. You have to click that every time. You can't make it a default yet, sharpen. And then there's also inverse, which is a really nice tool when you're showing patients. It basically just makes the whites and darks and flips them and reverses them, but it's really good when you're pointing out anatomy, showing the patient so they can really get a good feel of what they're looking at.
Yeah, Paul, I do like to know this. Oh, go ahead.
If you need to reset, you know, if it's too dark, sometimes it's just easier to reset things. That's what the little circle and the arrow is for right there, just to reset it back to your start. Yeah,
right.
Like that.
One other topic for the windowing, you can always right click and drag and just use your brightness and contrast that way. So that does change our brightness and contrast through there. And I'm going to go ahead and reset my density or my windowing there. And if you don't see this drop down here, you always have the little drop down here underneath where you can click up and down here. And let's double click and take us back to our original layout right here. All right. And I'm going to go up here to my reset, and you can see it resets right back to the original image through here. So this is a really nice window just to be able to navigate through and look for different areas. Let's rotate this around, go through that implant, scrolling at our 1 millimeter intervals, or looking back here at my third molar, rotating to look at the relationship of my molar to my nerve through there for extraction on there. Well, what do you think? Any other topics within this 3D pan window?
I think maybe just, and you covered it already, but the intervals, I think that's really important. So if we can just maybe just touch on that again. And I did get a few questions about that. So if we just kind of take a look at that,
sounds
that'd be great.
Good. So let's click here. We've got 3 different slices on the center here. My intervals are each one of these slices. So every time I scroll, I'm scrolling at a 1 millimeter increment. So if I come here and right click, we can go down to my interval and we can see, let's say I take this out to 5 millimeters, this will give us a visual. See how far apart my slices are? So as I scroll, I'm going 5 millimeters. So I may be missing some anatomy in between each of these teeth. So right click, let's change our interval and let's take it down to 1 millimeter and let's scroll through there.
Right.
On that. Let's take this up here and I'm going to go ahead and rotate And let's scroll over here. All right, let's just look at our one window here. Other options on here, the thickness. So what is my thickness? The thickness is going to be the mesial distal thickness of my slice here. So what are we seeing along this one slice? Right now I have mine set for 1 millimeter. You can change your interval or your thickness to different views. If I take it out to 10, we see how this gets really blurry. And this might be a good time to look at another one of our drop-down tools. Let's look at our annotation tool here. So I'm going to come over here to this first tool, which is going to be my pointer. So I changed this to a 10 millimeter thickness, which means along this slice, we're seeing 5 millimeters distal and 5 millimeters mesial to go for our 10 millimeters of a thickness right there. If I right click here and change my thickness back to my 1 millimeter, we're seeing a really thin slice across here, and we can go through that thickness through there. Paul, do you want to talk about these other two tools up here, the pointer and then our notes or memo?
Sure. So we have the pointer that Jim was just using there. We have and the pencil as well. So the pencil's nice if you want to mark something on there and leave it on there. You know, you may want to do a screenshot most likely, so you can mark something with your pencil, and then you can use, and you notice it stays on that one slice, and then you can use the piece of paper to put some text on there. So if you wanted to take a screenshot, you want some text on there with some instructions or whatnot, we can put words on there. You just click on it, type your text, and then you can pull it out of the way, you know, and do your screenshots from there if you wanted.
Thanks, Paul. The nice thing about this is we can also hide or delete that. So let's go ahead and hide this. I'm going to come here, right click and hide that also. And let's go ahead and hide that there. So that's some of our drop down tools from measurement. We've covered our capture and we've looked at our annotation through there on that. So I think we're good to kind of navigate from this section. Paul, as I'm navigating back to our NPR, do you want to kind of see if there's any other questions that have come about?
Well, yeah, I think if since you were on the 3D panel, if we can talk about the sculpting, might be nice.
Sure. I think let's go through our 3D image right here for sculpting. Does that sound good?
Yeah, that sounds great.
Awesome. So I'm back to my NPR window. We're going to do our drop down here and go down to sculpt. So what we can do is we can see we've placed our implant here on our first molar. We have our scissors here, and what I can do is I'm going to use this, and I'm just drawing a circle for what I want to cut through. So I'm going to cut out here the posterior area, and let's bring this together. And you can see where it says delete here or delete here. So I want to delete just this area. So I'm just left clicking here, and it's going to crop that out. All right, so you can see that's gone. Now I can rotate this around. Let's go from a more of a posterior view here. And I'm going to change this over to one of my VR colorings. I know we haven't talked about our VR colorings. I think now would be a good time. This is going to be our grayscale image, the MIP. I want to add some bone on here, and these are all labeled for different renderings. So if I click on bone, it adds our bone. But what we've done is we've cut this out, and now I can scroll across, and I can see the width of that ridge, the height of that ridge, where my nerve is in relationship to my implant there. So what I may want to do is right click on the implant here. I can go show controller, and we can grab this and we can move this up superior, down inferior. I can also come here and I can rotate that. If I go back to my show controller, hover on my blue line here and rotate that through. And now we have our implant placed, but that's how we're going to go ahead and sculpt through that image there with your clipping tool. If I need to reset that, I can always come here to my reset, and it's going to reset my image through there. We can go over here to our teeth mode, and we can see our teeth kind of highlighted on screen right there. Other clipping tools are sculpt, but let's look over here on the lower left, our apply clipping. If I click on apply clipping here, this is where we can clip different ways. So if I go sagittal, I can come here and grab and go to the left and drag across. Notice it does cut out my implant and my nerve. If I go reset, let's go to apply clipping. Let's go to axial, and now I can clip from the head down. Maybe clipping right to our root tips. Let's rotate this, and I'm going to change this to my bone view. And can we look at any of our root tips here or identify any canals through there? So we're going through, now we're at the opposing occlusion. If I need an occlusal shot, all the way through there, and then down through our implant, looking at where that is placed in the bone. If I do my reset, it resets everything, and we're back to our scan right here. All right. Right now, I would like to navigate over to our sectional tab. So this is going to be a tool that's going to be in focus next week. But let's just kind of go through there and give you kind of some previews for our sectional tab. So I'll go over to my axial window and scroll. I'm going to scroll down a bit, and I'm going to go over to draw curve. So two different ways to get there. If I click on sectional, it's going to draw an auto curve right here. So similar to our 3D pan, it just places generic points. Our scout's going to be our axial slice, our right side and our left side. Panorama view, our right side and our left side, and then our individual slices. So this is very familiar, what we were seeing in our 3D pan. I still have my navigation box over here where I can drag this line. I can also grab my line here, and I can use the wheel on my mouse to scroll across through here. If I double click over here, we're going to have one window, and we can scroll across that, looking at width of my ridge, height. We can see my sinus floor through there. I want to look at maybe a different way to do that. I can manually draw this, so I'm going to go draw curve. I'm going to click across the ridge in the maxilla and double click. That takes us to our curve over here. So let's do that one more time. This time I'm going to scroll down in the mandible, and I'm going to draw across. Note I'm always going clockwise across the ridge. And let's go ahead and double click here. And now we have our second curve drawn. As I scroll across, we can go through, we can see our nerve that's traced on line and scroll through there, and then rotate. Go back through, and there's going to be our implant. You may notice on your screen at your office, you have this set for a really thin slice. Right now it's set for 0, or our thinnest slice. We can see we're not seeing a lot of anatomy through here. If you go over to panorama on the side, I can click here and go down to our 10 millimeters. You can see my 10 millimeter focal trough across that ridge. Let's take that out to our 20 millimeters. See how that's filling in the synthesis of the chin right here. I can also navigate through and adjust if I need to on my windows down here. We have our certain number of curves added. My intervals, just like they were on my 3D pan, I can scroll across here and scroll through and go through each individual slice. Right now I'm scrolling at my 1 millimeter interval. And let's go right here through our implant, all the way through that, and then rotate our slice through here. We can go through there. So that's going to be our kind of an overall of our sectional view there. Double click back here, and we have our 3 windows. I think now might be a good time to look at some additional measurement tools. We have not covered those measurement tools there. So if I do my drop down, we've looked at our measurement over here. We're going to go over here to my angle tool, and if I click on that, hover over that, it tells us that's our angle tool. I can click here. I can left click, drag, left click, drag. It puts an angle tool on there. If I right click, it turns off that tool. I can move this around, and I can also grab this and move this around to change my angle. We may use this specifically for abutment angles. If I place my implant, we can change this and look at maybe an angle. We can adjust our angles here, right click, and delete. My next tool that I use is my multi-length tool. So I'm going to go ahead and enlarge slice number 119. Come over here to multi-length. And I can come down here and we can just left click and follow that canal. I'm making multiple points, and I can double click here, and that's going to give us our working length of 22.8 millimeters. So what I did there is I just came over to this and I just left click, kind of follow the contour and then double click, and we have our total working length there. And let's go ahead and right click and delete there. Paul, any other topics within the sectional window you think we should cover today? I know we're going to delve into this a lot more next week for all of our different clinical tools and doing a lot of adjustments here. I just want to kind of give a brief overview of this window.
Maybe show them how to delete curves.
Sounds great. So you'll notice up here 1 through 8, if we have too many curves, it's going to say, hey, you cannot draw any more curves. I could come up here, I can right click and I can say, let's delete curves. So now I'm back down to 1 curve. What I like about this window is it's going to save each curve that you've drawn on there. So that will categorize all of your saves or all of your curves through this window on that. Finishing out our measurement tools, let's double click back here in slice 119. We have our profile tool. So if I click on profile, I can left click just like taking a measurement and going across here. Gives me my pop-up window. So here's my profile window. So you can see my distance here, or my length, and then my Grace, my Hounsfield unit range on the side. So as I use my cursor, kind of watch over here, this white line, this is going to tell me we're out in soft tissue. I arranged peaks here on that cortical plate, in the marrow space, going through the tooth, cortical space, and then back into soft tissue there. So you can drag this, move this across. You could drag this, move this across, and then it's going to give you your average and then your specific range at the top of the green line right there. When I'm done, I can always come in here, right click, and delete that off of there. All right. Well, I think let's go over to our TMJ window here. So kind of progressing through. TMJ, what we do here is let's look at our overall window. We have our scout, which is going to be our axial slice, our right side and our left side. We also have these blue boxes here. The red line are going to be our slices down here, slice 24, 25, and 26 for our right side, and then for our left side. You'll notice we have our posterior and our anterior view. You may come to your scan where you do not see the condyle on here. What I could do is I could come over here to my defined TMJ area, and we can grab within our defined TMJ area, I can grab the yellow line, move that up superior or down inferior. We can kind of focus there. And if I use the wheel on my mouse over here in my condyle head position box, I can scroll down until I can start to see each condyle. So I think I have those pretty good in view there. We can click on OK. And now, as I drag this through, we can navigate through, scroll across medial, going back out lateral, looking at the condylar head relationship to the fossa, all the way through that. I do have the option of rotating this, and now scrolling further anterior and then back posterior, looking at that lateral and then the medial poles of the condyle. Note again, you do have all your windowing options for your sharpen, your max sharpen, and your inverse on here. And you also have your change layout. If you do want to change some layouts here, it's defaulted to our window right here. All right. I think moving forward, let's go over back to our MPR window and let's explore some of our topics over here on our simulation bar. So we've looked at our draw curve. We briefly looked at our insert implant. Let's go down to our measure airway. So some airway tools out there. I can click on measure airway. You notice I get my sagittal window here, and at the right at my cursor, I get the colorized measure airway icon. What I do is I follow my hard palette back to the center of the airway, and I'm just going to go ahead and left click here, and then I'm going to drag down and I'm going to go ahead and left click again. What this is doing is it's changing, it's doing a rendering, filling in that volume to show our airway readings. So you can see over on our sagittal view, it gives an outline. And in our 3D rendering, you can see that we do have our airway, but we do have our ramus and our condyle in the way. So what I do is I change this to my view here. I'm going to go over here to apply clipping. I'm going to drag this across. So let's cut this right to the midline of the patient or close there. We can bring that across a little bit more. I also like to do this. I like to use my soft tissue tool. And now we can see our rendering from a lateral view here. You do have your rendering volume over here, overall volume, and then our minimum area right here. So the smaller the slice is going to be, or the smaller the volume of the airway is going to be smaller in our range here. A way to visualize that is I can go ahead and right click here, and I can go down and go to measurement plane. I get this pop-up window here. So now I can come here and I can scroll down inferior or scroll up superior, and you can see my slice window showing the minimum area through that. So we could take a scan. If I were doing an airway scan on this patient, I would probably have them without the bite stick in eccentric occlusion, relaxing their tongue. Maybe we take another scan where they are in that appliance, and then we can kind of do a comparison progress for that patient there. And I'm going to go ahead and do my reset clipping, and we see we have our soft tissue rendering, which is under our VR coloring. Another VR coloring tool here is going to be our soft tissue 2. Click this off to the side. You can see it does fill in the airway there. I'm going to go ahead and hide that airway, and we can see our airway through there and some of our paranasal sinus. This may be where we come to our drop down here, and we can adjust that to highlight just the airway a little bit more going through there for some of our slide tools on there. All right. Moving down through here, we have our oblique tool. So I'm going to kind of look at some of the tools we used earlier. Paul talked about just double clicking on area of interest. So I'm going to double click down to that first molar. I'm going to navigate and rotate my lines going right through my image here, or my implant. Let's come over here and go to oblique. You'll notice now I have my oblique window in the upper left. So I'm going to go ahead and single click here, and you can see my green arrow, which is going to be the view in my oblique window. I could grab these boxes, move this in closer or out further, and I can drag this around and rotate that all the way through. This will allow me to change the orientation of my implant. We can move this up or down, and we can rotate to give us a 360-degree view of that image right there. We'll touch again on this when we do more of our implants, but this oblique tool can be used for any window there. Let's click back on oblique. I'm going to do my reset and go back to our original image there. All right, let's move over to our consult tab. Remember we took some screenshots over here. So change layout down in the lower right. You can see my layout windows. I have this set for my larger 1x2 window. So what I'm going to do is I'm just going to drag my pan there, my other window over here, or maybe we could do our sectional slice there. Over to the left, we have our main menu for different videos we have. So consult videos for our patients. So implant dentistry, all of our different implant videos. I can take these, I can drag this over, and it's going to go ahead and play our video. So there is no sound on there, but it does give us a video. We can talk to our patients about the implant planning process or any of our other tools that we're going to use. You notice over on the left, I have my favorites and recents list. I'm going to click on recents, and it gives me all of the images that I've looked at through here. So we've got a lateral sinus window. We've got endo for an apectomy. We have something for jaw surgery. You can also do your favorites And you can see down here, I have a different favorites window on there. Well, some of the questions I get is, can I export these windows or these videos? And they are proprietary to the software. So that is something that we are not able to do, is we cannot export those tools there. Lastly, let's go through our reports tab. We could drag our reports into this window. You can see I have my patient information at the top. I have my logo here on the upper right, information down at the bottom. So you can fully customize this window. If I go to change template, we can go over here and say I want to have my image with text at the bottom. We're gonna come here and I can drag my images here and I can type my text down here. Now from here, whatever I want to do with this is I can go down here to my export. I can export this as the PDF or JPEG. I can come over here. I can also attach this to my email. So you do have the option of setting this up to directly attach to your email. Or we can go ahead and go to our printers and print this out. You can change the landscape of this. You can do a lot of different tools with changing your reports through here. A couple topics we have not covered is our main menu bar here. One of them being is, how do I export this? If I need to send this over to a fellow dentist or a specialist, I can click main menu. I went down to export. I have the option to burn it to a DVD. I have the option to burn it to local disk. And what I mean by local disk is that we can save it to the desktop or we can burn it to a flash drive. You have your options to compress the image, and you also have your options to add your project or just add the viewer. So when the receiver gets this, they're going to have all the DICOM under CT. They're also going to have the viewer and then your project file there. So if I click on save, it's going to go ahead and save that. Once it's saved, if I come over here, I had it just saved to a folder here, and let's double click and look at this folder. So within this folder, I have got my CT, which has all of my DICOM. These can be opened in third-party softwares. So we did is just a raw DICOM. It's not proprietary to our software. I also have my launcher. So if you get this, you can double click here, and this is going to give us the options to launch. So two different options, Simple Viewer Original and Simple Viewer Lite. The original viewer, if you have your proper video card, is going to be our 3D-i software. You'll have your MPR, your section, your 3D pan navigation within that Simple Viewer there. If I go to Simple Viewer Lite, if we do not have the dedicated graphics card, we can open up what we call our Ez3D Plus software. It has your same four windows, your axial, your sagittal and coronal, and your 3D window, and all of your tools throughout that software. It just requires a less powerful video card on there. Other tools running down through here, go to third party. We're going to talk about implant planning and 3D diagnostics in a couple weeks. So we'll be able to go ahead and talk about guided surgery in 2 weeks. Importing a model or a secondary CT scan. Let's say we take 2 scans for our bite, ortho, or airway. We can import that scan with and without the appliance to see, or the guard to see the changes we have made. Export surface model. Let's say we capture a object, a stone model or a denture. We can take this, we can change our range, and then we can export that as an STL file. So that's something else we can do with the software. And then down here, file info is just telling us about the scan that was taken. Our settings tab, this is how you can customize your software and some of the settings on here. We have a full video on our website that does cover this, but you can change your teeth code, add your email in here, your clinic info, and some other customizing of your windows through there.